All right, let's first take you through what's happening on the COVID-19 front. India's daily count continues to trend upwards over and above 3 lakh cases in the last 24 hours as infections rise. Health infrastructure is still creaking. The key issue that we've tackled in detail on ET Now and on the India Development Debate on oxygen shortages does continue to plague top hospitals across the country. In Delhi, oxygen shortages are again on the brink. Hospitals essentially have oxygen supplies just for a few hours and continue to send out SOS in the public domain to save their patients' lives. Two hospitals, in fact, have gone to the Delhi High Court once again and asked for immediate oxygen replenishments. Let me go across first to my colleague Ruchi Bhatia on what is happening with the oxygen supplies in Delhi hospitals. Ruchi, there have been so many meetings, the courts have intervened. Are supplies still constrained in Delhi hospitals? What are the hospitals telling you?
Well, absolutely. The supply still remains constrained in various hospitals, various big hospitals in the national capital. Let me give you a little bit of a picture, Tamanna. In fact, in Gangaram Hospital, as of now, we're given to understand that they have supplies left only for about half an hour to about 45 minutes. Just about 5 minutes ago, a tanker, oxygen tanker did come in, but did not deliver because there was a confusion, and which is why they're now expecting the supplies to come in. In fact, they also requested the hospital driver to give at least half a ton of oxygen to them as well, but the hospital driver told them that they need to go to City Hospital, which is running low on supplies as well. And this is the situation with Gangaram, with Batra Hospital, with Max Fortis and several other hospitals as well. You did rightly point out that the courts also have intervened into the matter, but there's very little solace coming in for the hospitals today. In fact, some of them even stopped taking new patients today, given the fact that they had no clarity on the supplies. There were supplies running short for the entire of the national capital region as well. Some of the hospitals are requesting the district administration if the police escort vehicle can come in along with the tankers as well, so that essential time can be saved. And many of the hospitals also making a request now, if oxygen tankers can be termed as ambulances as well, so that precious lives can be saved and precious time can be saved as well.
All right, so that shows you that the grim picture still continues to develop in Delhi. And remember, there is a lot of information coming in on what is happening in Delhi. But there are many other parts of the country where hospitals are facing a similar shortage of oxygen. So what are we doing about it is the question. As of today, there has been some movement. The Prime Minister held a meeting with state chief ministers earlier today, and part of the idea of that meeting was to get more coordination on board. The Ministry of Home Affairs has also issued a circular saying that all states have to follow court orders of allowing oxygen vehicles, oxygen tankers to move safely through their territory. Otherwise, it will be a contempt of court. The attempt has been to get states to cooperate and not haggle and bicker over oxygen supplies. That's one part of it. The second round of important meetings has been with oxygen manufacturers, where they have been asked to put all of their efforts and capacities towards medical oxygen. One can only hope that all of this has a fruitful outcome over the next few days. Meanwhile, the Indian Air Force has been pressed into action to lift oxygen containers. You have the Oxygen Express also moving across the country. We can only wait and watch and see how this unfolds. So on the one hand, while we're trying to tackle the oxygen supply issue, let's not forget, in the medium term, the only way to beat back COVID-19 is to vaccinate everyone. In Mumbai today, once again, the city ran out of vaccinations in at least 52 of its centers. They were boarded up quickly enough and there was just no supply. Let me go across to my colleague Utkarsh Chaturvedi, who's telling us what's happening in Mumbai with vaccine supplies.
If you look at the numbers today of Mumbai itself, now I have the numbers with me, almost 52 centers out of the 132 vaccination centers are not working as we speak. 18 out of them, anyhow, and 11 government, 7 private, were running on very low stocks. But I've been told that's 5 by afternoon had already exhausted all the stock. If you look at tomorrow, what we've been told is that today 52 weren't working. Tomorrow 52 out of 132 will only be working, and many major government vaccination centers will also not have vaccine when we speak about what happens tomorrow. When we speak to BMC, when we spoke to BMC, what they're giving us a sense is that they also do not have a lot of clarity on by when will the new stocks coming in, but they believe that they will run out of the stock if the new stock is not coming in the next couple of days. So clearly, at a point of time when we are speaking about opening vaccination for all, the vaccinations for people who are eligible at this point of time is also becoming a big problem.
All right, before we move to our discussion for today, and we have a super panel lined up for you, let's just take you through what the vaccine math looks like. Now, this is important from the perspective that from the 1st of May, officially, everyone above the age of 18 in India will be eligible for a COVID-19 vaccine. One can only assume at this point that there will be more than enough people who want to get the jab, that vaccine hesitancy will start falling back. But in the meantime, it's important to look at what is available out there. So let's start by what the manufacturing capacity is as of today, and one can assume as of May 1st, because nothing much is going to change in the next few days. This is on the basis of what companies have publicly declared. So Serum Institute of India right now makes about 70 million doses a month. Bharat Biotech has claimed that it makes about 10 million doses a month. So that's about 80 million doses which are available today. But you have to understand, as per the new rules, 50% of this, that is 40 million doses, will go to the central government from May 1. The remaining 40 million doses will be up for grabs between all the states and union territories, between large private companies and private hospitals as well, who can also procure vaccines from out of India. They can import vaccines if they're available, but what's manufactured in the country, out of that 40 million will be available from the pie. Let me take this to the month of June now. And this is as per what these companies have said they will manufacture in June. So Serum Institute of India's production capacity could go up to 100 million, Bharat Biotech's up to 10 million, and Sputnik, which we will start importing, the first lot is supposed to come in by the end of May, is approximately 4 million. So you have around 115 million doses in the end of June, by June. Let's tell you how much we need. Now, as per reported figures, the estimated population of Indians between 18 to 44 is 600 million. I'm assuming here that you will want universal coverage and everyone will need 2 doses. So that's 1.2 billion doses required at least. We are clearly woefully short, and which is why some states have already said that they will be prioritizing those with comorbidities first for the vaccine. Remember, into this equation right now is not included what happens if Johnson & Johnson's vaccine gets a green nod, what happens if Novavax supplies come into play, Pfizer, BioNTech and other players. We can only hope that all of this speed up, because right now, as per the numbers, as per the data, it seems like we are some time away from enough people getting the COVID-19 vaccine, which becomes very, very important if we really want to beat back COVID-19. Okay, let's get to the big debate. We're focusing on corporate India this time around and for today's discussion, because we feel that corporate India can really do a lot more. Corporate India can pitch in the innovation that Indian companies show, the ideation that Indian companies show, that ingenuity can be brought in together to help the nation at its darkest hour from COVID-19. To speak on this, I'm joined today by Dilip Chenoy, Secretary General of FICCI, Vineet Agarwal, President of ASSOCHAM. On the show this evening, Dr. Niranjan Hiranandani is speaking with us, as is Prabal Basu, Management Advisor and former Corporate Director. Welcome to all of you and thank you for speaking with us today. Dilip Chenoy, let me start by asking you the simple basic question. What can India Inc. do right now apart from diverting its industrial oxygen to medical supplies? Surely there's much more that we can get together and do.
Tamanna, there are 3 different aspects of what India Inc. could do. First is, of course, in contributing to the containment. So, for example, we wrote out as early as 3rd April please follow COVID appropriate behavior, institute work from home, secure your workers. If you're using migrant workers, assure them that you will continue to pay them and keep them in the cities or in the locations where they are, and also vaccinate your eligible people above 45 in that lot, and encourage them to vaccinate. So that was the first. The second thing was that in many states where testing became mandatory, we actually started saying that look at not only RC-PCR as a test for getting workers onto the road, look at alternate testing, ramp up testing capabilities. They've also said that if allow corporates to also test if they can actually do that. The other thing is that in many states, the state governments are asking us to sanitize markets, work with different segments of population, etc. But the four big questions that you have and are there. One is the hospital infrastructure. So corporate India, including hotel chains, are actually working with hospitals and the state governments to create hospital facilities of varying categories in different hotel rooms. And even if I were to take even smaller ones, they are typified by the OYO type of things. So OYO, Apollo hospitals, and Hindustan Unilever, etc., have this thing of setting up eye care centers. The second, you refer to not using oxygen, but many corporates are actually investing in oxygen plants. Many corporates have actually modified their argon and nitrogen tankers to be able to carry oxygen. Some corporates are also looking at getting containers and tankers, which you are looking at that. And of course, the plants are coming up. In terms of equipment, other equipment which is required, people feel that it's only PPE, masks and all, but other critical oxygenators, other critical equipment are also being sourced. And of course, the healthcare and the pharma, the private sector have contributed significant amount of, ramping up of capacity going forward. Finally, for example, FICCI itself runs in Delhi a small food laboratory has converted into COVID testing center. Similarly, if you look at setting up a helpline for non-COVID patients, so multiple things can be done. Working with the state governments to ensure that the whole policy and process ensures delivery of essentials in lockdowns and containment zones, and keeping other aspects of the supply chain active. So multiple things every day. A state government, a city government, a municipal commissioner reaches out to industry for support, and we try to do our best. Some innovative solutions are doing, combinations of using IT to determine beds, to determine, transport routes for oxygen, also are in the works.
I appreciate, Mr. Chenoy, what you're saying, and whenever governments are or administration are reaching out, large companies are doing whatever they can. My question is, can more be done? Let me take this to Vineet Agarwal. Mr. Agarwal, for example, all the major companies have said that they will vaccinate their employees and their families at their cost. Can this be extended beyond just their employees and their families? Can companies say that the area where I function, that location, that locality is someone I will take care of? Can companies get together and find a way to streamline this whole process where people who are in need of plasma, medication, bed, oxygen go on social media, then someone collates that information? It is all haphazard right now. Cannot our startups come in and pitch in? My point simply is that a lot more can be done at this hour instead of just watching and waiting in horror like everyone else. Mr. Agarwal, your thoughts?
No, I certainly believe that a lot more can be done, and I believe that a lot of people are doing a lot. I think if you see what started off in Saturday and Sunday, between now, there is a big change in terms of that information that you just mentioned, the way that people are reacting and responding, and all kinds of ingenuity in terms of how people can get access to oxygen, and corporates are helping there as well. They are ensuring that they are able to provide these, whether it is oxygens or certain kinds of equipment as well. When you mentioned about vaccination, I think the responsibility of any corporate would go beyond their own employees to the ecosystem that they manage. And that ecosystem could be of course, their vendors, their suppliers, their contractual staff, even their and in some cases could be small cities where they operate, the small towns that they operate. So certainly it can be expanded beyond their remit of just specifically their own employees. So that's certainly there. I think we also have to take this problem a little bit from a longer term perspective or a medium term approach. So let's not even talk about long term because we are in a crisis right now. The immediate medium term requirement to set up PSA plants. These are oxygen generating plants that can be put up with the hospitals. There are 3,700 government hospitals in urban areas and 20,000 government hospitals in rural areas. And less than 5% of them have these PSA plants. What are these PSA plants? These PSA plants actually convert the oxygen that is in the air into oxygen that can be used by the hospitals. Now, setting up a plant like this takes nowhere more than 4 to 6 weeks. There are 25 manufacturers in India, and they're all listed on the GEM portal. So, and the payback for a hospital is less than a year. So, I think the government has to mandate this. They have to mandate that all hospitals above a certain number of beds have to have a PSA plant. So this can actually start a chain so that we are ready, not just in the next 4 weeks where the wave hits some other city, but also subsequently there's a third wave or a fourth wave. So I think we have to start looking at that as well. There is a role of corporate, but there is also a role of government here as well.
There's no doubt that government has the primary responsibility. They are the ones voted to power, they're the ones collecting the taxes, and they are the ones who have to implement it. Unfortunately, they are the ones also who seem to have lost the plot a bit right now. Hopefully, they will pull it back. I mean, I have no qualms saying it. There is complete mismanagement at local and federal level. My question is, what can India Inc. do? Surely we cannot just be bystanders right now, Mr. Hiranandani. I mean, you have another ilk of celebrities who've jetted off to the closest holiday destination to get away from it all. But one would hope and believe that corporate India is not going to shy away at this hour and come forward with some really superb solutions.
Tamanna, this should have been done long back, but unfortunately the questions are coming now when the whole thing is absolutely on fire. Could have been long back. The first thing which Mr. Vineet Agarwal said about PSA oxygen generator. I have a 250 bedded hospital, and in 4 weeks' time we will have our own oxygen generator installed, which will take care of the 250 bed hospital. Similar to this, about 20 of them more will happen in the city of Mumbai, of course, provided they order them immediately. Similarly, the state government, I believe, is also ordering in the next 1 or 2 days 19 or 20 more plants of this kind. So you could have by the end of the month, a month from now, about 40 to 60 operating PSA oxygen generator, and these will not require oxygen from the plants which are now presently operating on that. That's step number one, which I think we have taken and our hospitals are taking, and the private hospitals are also ordering this. But there is a lead time of 4 to 6 weeks before it can be installed and bought. These plants are also available all over the world, and they can even be airlifted and installed in the factories, and the urgency is sufficient enough for us to do that. But as again Vineet Agarwal just mentioned, there is a possibility because a large number of manufacturers are there in India too, and some of them are able to get these assembled very quickly and bring about into operation. So that's point number one. Point number two, vaccinate, 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 vaccinate. However, my hospital, which was vaccinating people in the last 1 month, has no vaccines in the last 4 days. They've stopped supply to us, and they are only giving it to I don't know whom, because we are certainly not getting the vaccination. Now, we were vaccinating between 400 to 550 people per day. And in the last 4 days, we would have vaccinated 2,000 people only in one hospital. Similarly, 52 other hospitals are devoid of vaccines today. I don't understand. We contacted Serum Institute and they said they were supplying it to the central government and they have a commission to do so. My company contacted them also and they said they will not be able to discuss with the private sector or the private hospital for the next 30 days. I don't understand what that means. Even if 50% is supposed to be given to central government, what about the balance 50% which is supposed to come to the states and the private sector and other people from May 1? But we have no response to that. And they said, no, we will first have to keep up our commitments to the central government. So it will be only possibility of central government to do it. And you're asking me as private sector to do it. How do I do it if there's no supply of vaccine? So we need to get the supplies, whether it is imported, whether it is through our local suppliers who are actually the right people to get it from. And prices
let me
also
just come
affordable.
let me just come in on a very important point. If you will allow me to come in on a very important point, you're absolutely right, and you're speaking right now from the perspective of someone who runs a private hospital. 1st May is going to be mayhem because everyone is going to log in onto the COVID platform on the 28th, because everyone is seeing the rising cases and wants to be covered. People also know that younger people are being impacted terribly this time by COVID-19. So vaccine hesitancy is going to drop down. My question is not only about trying to corner that 40 million which will be available technically from May 1, and we spoke about those numbers a little early in the show. Can large corporates not get together and become a very important and powerful buyer in the international market right now? Can we not go beyond and figure out way to move stocks faster?
No. We didn't know till 20 minutes ago that we would not get stocks from India. So we are supposed to be the largest manufacturer in the world. The other companies worldwide are already committed to other countries to the world. So the country has to first work out with the companies in order to do it. And as you know, 2 of the largest suppliers of vaccine in the world are still not approved by the central government, by the agencies that are there. So the central government will have to show us the way with whom we can negotiate and do it, or which are the companies which we're going in. Because when we go to the companies, they will have to get a prior clearance from the central government or the authorities which give these clearances. So we don't know anything about this thing, and what are we allowed to charge, what are we allowed to pay for, and what is the extent to which we can probably negotiate with the people. These are all controlled by the government at this point of time, and we will look forward to government's guidance in order to do so. But you're right, Tamanna, if on May 1st we are not able to supply these vaccines, there will be a rush on all of us and the hospitals and even the corporates. We've taken some responsibility. We are happy to follow it through. Vineet just mentioned that we should do it for our employees, for our suppliers, for our security guards, for our migrant workers. All these people will take care of around us. And then, of course, the neighborhood in which we stay and work around, we'd certainly like to do it in our neighborhood. But how do we do it if we don't get the supply? So that's one of the major things. So one, oxygen, PSA oxygen generators, vaccine availability that we really need to take care of as early as possible. And also to see that all the other equipment and other things, how do we expand the hospitals? I think a special clearance should be given for all equipment and supplies and medicines. The taxes and other things should be reduced so that the prices of all this can be reduced. And also expansion of hospitals should take place in all across the board, including the government sector, and special concessions given to private sector who expand the hospitals or facility in the next few weeks. Number 3, I'd like to put one more point before you pass on to somebody else. And that is, let's say that there's going to be a third wave after 4 months, 3 months, 4 months. Are we ready for the third wave? And if we don't vaccinate the people now, you will have the third wave. So before we get the third wave, you can preempt it by vaccinating the maximum number of people, or else prepare for the third wave.
No, so the vaccine math and the lack of vaccine is a well-known problem. You are right in saying, Mr. Hiranandani, that it will have to be resolved at a national level as well. India will have to negotiate with players. States will have to negotiate with different vaccine suppliers, which they now are able to do. But I want to go beyond vaccines as well. And Prabal Basu Roy is with us as well. Prabal, vaccines is a no-brainer. If there is supply, then people can step in and do something about it. But is that it? In your view, are there no other innovative methods that India Inc., that corporate India, that big companies can come into? Now they have CSR exemptions for a lot of COVID activities as well. For example, can funds not be pooled in to help those in distress with hospital bills and medical bills that they just can't afford?
See, Tamanna, this question about whether, let's say, corporate India is doing enough or not needs to be contextualized, to really give an answer. India is at war, right? And the responses during a war have to be very different. And many entities in the country need to sort of work together to make it happen. And they have different roles. The first role is, of course, the first entity is the government. So they provide leadership, strategy, policy, coordination, global reach, outreach, infrastructure, and they fail miserably in this. I mean, there is no harm in that's the way it is. Now, as far as corporate India is concerned, it has been in the forefront in multiple ways. Let's look at it. I mean, we had a similar program a few months ago with Mr. Hiranandani, myself, and you. About 6-7 months ago. No, we have been in the forefront. Just look at it. Many of the corporate hospitals are corporate hospitals. The oxygen manufacturing is done by corporates. Medicines, vaccines. In vaccines, own money has been put in by Serum Institute and Bharat Biotech. 4,400 crores of which was own resources and the Melinda Gates Foundation. Government gave zero, by the way. So the point is, we have scaled up PPE kits, as you know. We've done a lot of things. Now, the question is, Mr. Hiranandani raised is very, very valid. If we don't get the basic infrastructure, what is it that we do? Yes, we can have buying power, like you said. Companies can come together, buying power, but we still need a policy framework around it. So things can happen, but initially, at this moment, since there is so much fire going on, we need a policy framework to show the way so that people can do something. CSR is a no-brainer. I mean, CSR companies have already started doing it at the local level, the local government level, doing things which ideally a local government would do. Strengthening the preventive healthcare system, doing some responses to water and hygiene, stuff like that. They're also getting, from what I hear, there are some makeshift hospitals which have been started by corporates, at least in Bangalore. COVID care centers with oxygen concentrators, doctors on call, etc. So those things are happening. But to manage it at this scale, industry-wide, cooperation will require some guidance. So that is what is missing today, by the way. And it's a very sorry state, but that's the way it is. So let's hope things become better now that.
Prabal, I get your point, but what you're talking about when you're saying that the private sector is making vaccines, the private sector has hospitals and corporate hospitals are there, that's fine. Those are services being rendered. That's not what I'm talking about. I'm talking about going over and beyond. Where, for example, is Startup India. We've had 12 unicorns this year and crores have been raised. I mean, maybe I'm extrapolating a little simply here, but can one fund not be created for people? You know of the stories of people who enter a hospital for COVID treatment, are slapped with a bill of 3-4 lakh rupees. It may be legitimate, but they just can't afford it. Now you've had, after a stick from the finance minister, insurance companies forced to take cashless treatment. Are you seriously telling me that nothing more can be done? Can we not get one app together to really direct the flow of requirement, for example, of plasma donors to connect with plasma donors?
Look, there are some
you want to take that before I get reactions from everyone else? It's all well and good to say we're doing everything we can. Clearly more can be done.
Absolutely. And you'd be surprised, Tamanna. I mean, there are in Bangalore, I'm aware of in Bangalore startups and smaller technology companies and techies really have got together and created some data banks and websites by which plasma medicines, etc. They are trying their best, but the inputs still have to come from somewhere. So, but it is being done. They have done it on their own. They've completely done it on their own. Now, as far as throwing money is concerned, yes, absolutely. Insurance companies are there. Some part of CSR funds, as you rightly said, would go to needy patients if so be it. But that is still not the main issue. The main issue is there is no oxygen to breathe. That is the main issue. There is no infrastructure. There are no vaccines, as you heard. That is the main issue. To some extent, money can be spent, and I'm sure some of the larger corporates whose balance sheets can support will do that, and they have done it in the past.
No, so yeah, that is so okay. Let me get Mr. Chenoy into this as well. So yes, Prabal is right when he says the main issue is there's no oxygen, there's no vaccine, but to have enough of that today, we would have had to go back in time, create those capacities, and be aware that we'll come to a state where we have nearly 3.5 lakh daily cases. Clearly, that's not the situation. What can we do now, Mr. Chenoy? And this is beyond, we will help if someone calls us up and asks for help. If a local authority says, please help me, we will help. Don't you think it's time that, organizations, large associations like yourself went beyond that, sir?
Anna, let me just tell you what we did, and this relates to your earlier question to Prabal about startups. So we did a startup challenge about COVID, COVID challenge, how you can actually address COVID. We funded these startups to actually accelerate them. One of the startups called Shikokan actually developed a product. It's like an air purifier. If you put it into a room, it neutralizes, not only the COVID, virus, but also other viruses there. We pushed for testing. I think it's the final stages of testing by CCMP. We're trying to get it out into this. We are also supporting some startups who have found innovative ways of actually even sharing oxygen cylinders and developing apps to share oxygen cylinders, share equipment which is used to produce oxygen, and create an app around it which can be used by the hospital. This is just two examples, but a lot of other people are actually doing that. The challenge, as Prabal actually put it, is the primary data of how many hospitals, how many oxygen cylinders, how many PSA plants, which so nicely Mr. Hiranandani actually explained. How is it that you get all this information onto a platform? Actually, the CoWIN or the Arogya Setu app is an excellent platform to build on. It's got all the different features. So we just got to plug in the data. And here, because the problem is to get data, people need to be out in the street. But here within the containment zones, you can't have feet on the ground. So we have to actually depend on other people to provide data. And there are things that people are actually trying to, get data from TPS, collate it, try and predict availability of beds, etc. So a lot of stuff is happening at the local level, and people are funding it. And all major innovation actually starts small and then grows. So a lot of this is actually happening on the ground here. Working with district administration. Bangalore, as Prabal said, is a great example. New commissioner, extremely energetic, involving industry reaching out to him proactively. It's happening around different municipalities across different states.
Yeah.
Proactive basis, not in a risk.
No, okay. So yes, I'm sure some movement is happening. My question simply is, can we do more? I'm sure there is. The best minds in this country who have built businesses of great value can surely use the good old Indian jugaad, which helps so much in navigating Indian business to help us out of the COVID-19 crisis. Let's throw everything we have at it, is the simple plea. Thank you so much to all of you for joining us on the discussion this evening. We'll take a very short break. When we come back, ray of hope coming in on COVID treatment. Zydus' drug Virafin has got an emergency approval for treatment of mild cases. We've spoken with Dr. Sharvil Patel, MD of Zydus Group today. We'll play out that conversation for you after this very short break.